Welcome back. Here we have listed a few treatment options in the management of pain. As discussed earlier in the brain analgesia system, perception and subsequent suppression of pain is not just the job of the brain. Okay, we are here to understand the process and combine science with nature to offer a helping hand to the brain. So here we begin. Here we have a few treatment options, but we have a temptation to move on to the pain medications. That is not the case. To begin with, the foremost important thing is to stay away. The moment you realize we have a painful stimulus, just stay away. No injury, no pain. Okay? Still later, before moving on to the pain medications, it is of paramount importance to treat the underlying cause. For example, if we have pain due to a fracture in one of our limbs, God forbid, it will not settle with pain medications unless we get it seen by an orthopedic surgeon and fix it by surgery. Okay? Similarly, a big abscess on some part of our body will continue to cause pain without incision drainage or some specific treatment of the cause itself. Okay? Still later, we have certain pain medications and we prescribe them commonly, but they too are with their side effects. It is just okay to prescribe them for a few days to few weeks, okay? But the bigger problem is they cannot be used indefinitely. We commonly use the non-steroidal anti-inflammatory drugs like diclofenac sodium, like chlorbuprofen, like mefenamic acid or acetaminophen, but they cannot be used indefinitely. Secondly, we have the opioid drugs, the narcotic analgesics, which are far superior to NSAIDS, but they too have their own limitations. In general, NSAIDS cannot be used long term because they have a tendency to cause GI problems, particularly ulcers in the stomach or intestine. Okay, so it is a great fun that we prescribe a certain NSAID for certain painful problem. The pain settles and the patient moves on to a gastroenterologist to treat his ulcers in the stomach. Okay. Similarly, they cause aggravation of hypertension because they cause salt and water retention by the kidneys. That too is a problem. Pain relief at the cost of new onset hypertension or aggravation of pre-existing hypertension. So this is why we say we can't use them indefinitely. Similarly, the opioid analgesics. We have so many of them and they are far superior to the non-steroidal anti-inflammatory drugs in terms of pain relief, but they too have their problems. For example, they cause sedation, they make you drowsy, and in terms of work performance, a drowsy man is good for nothing. So we never like them because of their sedative potential. Secondly, they have a potential for causing addiction. Any patient who takes them for a few days or weeks has a desire to continue them long term because it causes addiction. And at the same time, we take them for a few days, we are just okay with pain because it offers greater pain suppression as compared to other drugs. But the moment we stop them, the pain recurs, even in a more severe form. This is what we call withdrawal. Okay, so owing to those limitations, we can't use them long term. Similarly, as we discussed earlier, there are two components of pain, the pain itself and the emotional response associated to pain. So whenever we feel like the emotional impact is far greater than the pain itself, we may prescribe certain anxiolytics, sedatives, or antidepressants in selected patients. Okay, but either way, we can prescribe them for a few days to few weeks. We can't use them indefinitely. Okay, still later, we have a technique probably invented by the Chinese people, and a part of complementary medicine. It is called acupuncture. You would have seen they stimulate certain parts of our body through those needles. They have multiple needles, okay, and through needle stick injuries, they stimulate multiple points, specific points of our body to cause pain relief. And pain relief is not the only indication of acupuncture. It is utilized for so many other indications, but pain relief is just one of those. Okay, so initially we had a poor understanding of the mechanism underlying pain relief by acupuncture, but if we see it from a physiological perspective, now we have good enough evidence that they improve the behavioral response to pain, that emotional component of pain. And from imaging studies through MR imaging or EEG, electroencephalography, what we know, they increase the activity in certain parts of the brain, particularly the thalamus and insula, okay, those areas concerned with pain suppression. At the same time, from a biochemical perspective, they increase the levels of beta endorphins, and perhaps I don't need in the brain, and I don't need to repeat that it is one of those one of the components of the brain opiate system. Okay, so higher level of beta endorphins in the brain due to whatsoever mechanism causes greater pain relief. At the same time, they decrease the levels of prostaglandin E2 and cortisol in the body, and these two have their own implications. Prostaglandins tend to sensitize the pain nerve endings. Okay, similarly, stress as a component, stress makes pain worse, so a reduction in those stress hormones like cortisol too accounts for some pain relief in these patients. Okay, still later, well, I forgot to mention the gate control theory that needed to be discussed before everything else. The mechanism underlying the gate control theory is suppression of pain signals through activation of some non-pain pathway. Okay, this is like if we have a painful stimulus arising from any part of the body, particularly if the pain is acute, we have a reflex action to go for intense rubbing of that part of the body. Okay, and what they propose, it causes intense rubbing, and that connection causes co-stimulation of the tactile receptors of the dorsal column medial lemniscal system. So what we experience, we have a pain stimulus and we go on to induce a non-pain stimulus, a touch or pressure stimulus. And at the level of the spinal cord, when both those impulses, the pain impulses and the tactile impulses arrive in the spinal cord, the non-pain impulses cause lateral inhibition of the pain impulses, so that the perception of pain due to lateral inhibition of the pain impulses here in the spinal cord offers some relief. Okay, initially I had a perception that the gate control theory probably helps only in acute pains. Okay, and still later I realized, you must have heard of massage. Particularly from my childhood years, I recall that my grandparents used to frequently ask for a massage. Okay, by the time they are old, they have multiple problems. Their muscles are weak and fragile. Their bones too are weak. They usually have osteoporosis of bones. At the same time, they have certain joint problems like osteoporosis. Okay, and when they ask for a massage and find it soothing, so probably massage is the logic behind massage as a source of pain relief is the same, the gate control theory. It causes stimulation of the tactile receptors, the light, touch and pressure receptors in the skin, and causes lateral inhibition of the pain impulses at the level of spinal cord. Okay, so what we conclude, it works in chronic pains as well. Okay, still later we have what we call TENS, transcutaneous electrical nerve stimulation. When it was introduced, it was a fairly invasive procedure. They used to stimulate certain parts of the brain through electrodes. Okay, particularly they found relief of pain with stimulation of some parts of the thalamus and the limbic system. Okay, it used to be an invasive procedure. Still later, with advancements, we now have those handheld devices which deliver pulses of electrical current of varying strengths to the skin. Okay, and what we see as a relief, at least a temporary relief in those with pain. Okay, and this too, the TENS in a way utilizes the gate control theory through suppression of pain signals through electrical currents. Okay, still later. Now you might have seen we are moving gradually from non-invasive procedures to invasive ones. Okay, now here at this moment we discuss the invasive procedures that can be utilized in selected patients. What we see, the first order neurons in the pain pathway are the free nerve endings. Okay, free nerve endings that transmit the impulses from different parts of the body to the spinal cord. Okay, and their cell bodies reside in the dorsal root ganglion. So in those with chronic pain that is not alleviated the aforementioned options, what they can possibly do through a surgical procedure, they destroy the dorsal root ganglia at selected points. Okay, selected points. The pain needs to be well localized, and the dorsal root ganglion in this case that are manipulated needs to be specific to those areas. Okay, and still later, what we know from the second order neurons of the pain pathway, they ascend, the second order neurons fibers cross to the opposite side and ascend in the interior and lateral columns of the spinal cord, the lateral spinothalamic pathway, the interior spinothalamic pathway. Okay, so if somebody has got chronic severe pain, doesn't find a relief with the aforementioned options, so surgically what they do in the thoracic cord, okay, at the level of the chest, somewhere at the level of the chest, in the thoracic cord, they cause manipulation or partial destruction of the white matter columns, thereby interfering or interrupting the ascending pain fibers, cordotomy. Okay, and the lateral spinothalamic tracts. Still later, we can, there are selected patients. Here the problem with cordotomy is the pain relief in this case is partial and temporary. Okay, there is pain relief say for a few months, 2 to 3 months, and recurs. And what they propose or postulate is there is recurrence of pain due to activation of alternative pathways like the spino-reticular pathway. So pain signals begin to be transmitted through those alternative pathways. Okay, and in selected patients we can go for thalamic surgery. Now this is a procedure where again they have to manipulate with the pain suppression areas, and we discussed earlier that thalamus is one of the very important pain suppression areas. So here through stereotactic surgery they manipulate or even destroy the intralaminar nuclei of the thalamus, and the results are promising. Okay, many of the patients, they say over 70% of the patients find some pain relief with thalamic surgery. Okay, so this is all about the different options we have in management. But what you do need to understand, we always proceed from a non-invasive to an invasive procedure. Okay, going for dorsal rhizotomy or cordotomy in first place won't be a clever or logical option. This is all about pain, and thank you very much.